Hello again, all you beautiful people. Here we are again. Solo Snake72 Podcast, episode number 6. Definitely appreciate you revisiting here and any thoughts that you may have sharing. Please don't forget to either like or don't like the episode on YouTube or any of the other platforms. Also, if you think it's relevant, it helps to have any of it shared. So don't forget you can do that for your boy. So today we've got a great episode. As promised in the follow-up, we're going to talk a little bit about kids that are going back to school. I know a lot of children are set to go back either this past week or this week that's coming up or something different completely. But I just wanted to throw some quick research tips out there that I came up with. Sorry about the delay. We didn't make our 72-hour timeline this time. We're a couple of days late, but my kids, in my situation, were schooling from home, so that was quite a challenge and an adventure. So things are looking up and we're doing a lot better, but that did present quite an obstacle in getting some podcasting done. So hope I didn't disappoint anybody out there, but if I did, fuck you. So going through it, I've got it set up here. We're going to start talking about some suggestions. And again, my kids are schooling from home and I'm not a doctor. So this is just stuff that I've gleaned from a lot of different resources and talking to people and looking at different podcasts and doing my research on the internet. And I encourage you all to do that as well. Quick shout out to all the platforms, Instagram, Facebook, YouTube, and Twitter. We're definitely appreciative for the technologies and the softwares that you've developed and keeping us connected as human beings. So without further ado, we're going to move right into it. Back to school in a pandemic is going to be the name of this podcast. So the first thing that we're going to talk about, and shout out to Rogan on this one, I know you'd appreciate it, but nutrition and exercise are probably more important now than they've ever been before. Both because of the pandemic and kind of the state of our nation. If you really kind of boil it down, I don't know that we're doing so well with our health and wellness. So that's okay. That's something that we can recover from. But I just wanted to make it a point here that it's very important more now than ever just to preserve life and to be strong enough to to fight off something like coronavirus if you should happen to contract it. So there's a lot of resources out there. I'm not going to give you the lecture about what you should eat and because again, I'm not a doctor or a nutritionist, but I do want you to take some time to think about those things about nutrition and fitness as it's relevant to your life and as it fits with your abilities or your dieting. It's definitely something that I think can be influential here in the situation of kids going back to school. So the reason why I think that that's so relevant is because I want all of the parents that have kids that are going back to school to practice with the perspective every day that your child is going to come back with the coronavirus either on them in some way or as a asymptomatic carrier. Asymptomatic meaning that they are not showing any symptoms and, hopefully, don't come down with any illnesses. But I think the most prevalent scenario that we may see here is that we have children that are carriers or silent carriers or harmless carriers to themselves, but they may come home to a nana and tata or a grandmother, a parent that has an immunocompromised situation. And I think we're going to see a lot of those scenarios a lot more often. So as the parents that are going to be in those scenarios, I want you to, for your safety, because I give a shit, I want you to consider the proper hygiene and disinfectant methods. I'm not a doctor. I'm not going to tell you which ones to use, but I just want you to consider making it a practice when your kids come home. Teach them the ways that they can also be influential and integral to your family's health and to take it seriously. We're going to talk a little bit more about that, but that was an important one, so I just wanted to jump on that. The other point that I want to talk about is immunization and flu shots. So not a doctor again, but I just think that right now it might be an important time to try and make sure that those things are kept up on as much as possible. Obviously, that's something that we wanted to be doing all the time as parents, but now more than ever, I think it's important to make sure that those things are up to speed so that there aren't complicating matters that come in that would further expose you and your child to coronavirus or anything worse than that. So I hope there's some health providers or healthcare providers that kind of step up here, and offer some type of mobile immunization, because the fact of trying to bring kids into a children's hospital, it creates the opportunity for contamination, and for the virus to be transmitted further. Those healthcare companies out there, hopefully you get wind of this, and there's something that comes out there to keep people, safe at home and still being able to get their kids immunized. And maybe the flu shot is going to have a great influence or a great effect on potentially the coronavirus as well. So just looking forward and being optimistic on that one. Let's try to accustom and reward our children for wearing their mask for several hours. That might be something you can do if you have your children starting, sometime soon, or just to practice wearing their masks, just kind of thinking about it. Learning models are going to be a lot different working or going to school for kids now. So it's likely that they're going to not have as many physical activities where they're, in close contact with other students. They may be sitting down and doing, online learning or video type learning for long periods of time while they're wearing masks. So I think it's something that we can do to kind of arm them and prep them to get ready for that, is just to kind of have them wearing masks at home. Just for 30 minutes maybe at first into an hour, just so that they're not so surprised and unaccustomed to wearing the masks. So, the other thing that we want to talk about is how to social distance while they're in school. It's hard enough, for students that are going to school and that are going through this whole social distancing and pandemic to understand it and to acclimate to that absence of human interaction. So we should practice, the concept of magnet pushes. So that's where, when you get magnets that are similarly charged, they'll push each other apart. So I think that you can kind of demonstrate that in just how they can make sure that they're keeping the adequate distances away from other students, and understand that they may see their classmates or their students that are exhibiting different signs of being sick, and just to be able to communicate those to you as the parent so that you can consider whether or not your child has been exposed, and any other further contact tracing that may be feasible at that point and helpful to the solution to this pandemic. So again, I'm not an epidemiologist, just throwing it out there. Do your own independent research, people. But just wanted to provoke some thought and get your attention towards those things and doing that research. So get your kids a cool mask that they'll enjoy wearing, their favorite superhero, their favorite cartoon, whatever the case is, but something that's cool that they'll enjoy wearing and that they'll be happy about. So maybe that's not always applicable, but I think that that's something that can also help along in the situation. It's just a small tweak here. Consider packing them a lunch. I don't know what their every school's lunch situation is, but that's potentially an opportunity for them to be standing in a line with other kids in a close proximity, at the serving, while they're serving themselves, they'll be with other kids. And there's just a lot of opportunity for cross-contamination there. So I thought it might be a good idea for us to consider maybe just packing lunches for them. Number one, we can ensure that they're eating, healthy and nutritious foods. Not that there's anything wrong with school lunches, but we can often supplement that or overscore that with stuff that we prepare from home. So I think that, if we just pack their lunches just for a while, hopefully, I think that might be an element of a layer of safety that we can add for them. Make sure to celebrate and high five. Be physical and hug your children. After you've done your disinfecting from school, obviously. But the point is that in the new model or the new normal of going back to school, I'm certain that there's not going to be the normal interactions of high fives or pats on the back or students that are being physical together. And I think that absence could be potentially dangerous to their development. So, as parents, we can be overabundant with that stuff when they get home, because we realize that these types of acknowledgments and interactions at school probably aren't going to be happening for a good reason. So, and that follows along with the social distance things that are going on here. Parents, be a good role model about practicing good hygiene, health and wellness, and social distancing practices. We can't expect our kids to go to school and be consciously, safe or socially distant, to protect themselves when we as the parents have guests that are coming over, friends coming over, we're not wearing masks, like the whole nine. I'm sure you can figure out the rest of that. But, do your research about ways that we can reinforce and encourage these practices and awareness with our kids. I'm not a doctor or a pediatrician. I've been switching that up. But still, I think that, those things are easy for any rational parent to understand why they may be important. And finally, have a contingency plan in case either your child or yourself, becomes positive for the coronavirus. Have an idea or a pipeline built of which healthcare provider that you're able to go to, and what the drill is going to be. If you or your child is quarantined for 14 days, and hopefully they are able to recover and are testing negative after that, is that something that your family can embrace? Is there a plan that you have? Is there any support system that you haven't considered perhaps of what you may want to do if you are sick or your child is exposed and has to be at home for 14 days? And in a lot of situations, parents are working and they may not, have the time, but it's important to have that conversation with your management or your leadership and just to kind of understand what the options are or the resources are out there. A lot of companies are doing some really amazing things to make sure that their employees are able to manage through a situation or through these situations in this pandemic, and they're empathetic to a lot of these scenarios. But if we're not talking about these and redoing our research at work, we may not be aware of what those options are and potentially not capitalizing on them and creating a much worse situation than we're already dealing with. So that's all I got for you folks. I was going to make this one a quick one, and I promised to put it out there. So I hope you enjoyed it. Please share, any feedback in the comments below. They may not only be helpful to me, but to all of our other audience that is probably dealing with some similar types of scenarios. So I'm going to go ahead and let you go. Enjoy the rest of your weekend. But as always, would appreciate your thumbs up, thumbs down, and share it where you can. All right, y'all. Enjoy. Bye.